to YouTube Live. And so, what I had said in the title was Changes are here and there are more to come. So, here's what I'm going to say. Hello, everyone. Sandra Ford, Senior Compliance Officer with Trusted Senior Specialist. And I am talking about changes that are here that began January 1st, 2021. And changes to come is the topics that we're going to be covering in the next quarter, which is just a few days away. I sound like a weather person, just a few days away. We're talking about what will begin in April. And then for that entire quarter is going to be a series of people who are new to Medicare. But it's not just about enrolling in Medicare. It is all the different scenarios that will apply to somebody. We did a segment on the 9 scenarios, and I'll explain a little bit what I meant by that. But it's going to be Medicare for people who are veterans, and again, I always say thank you for your service. That is a very huge sacrifice. Thank you for your service if you are a veteran. But we will talk about the difference between using Veterans Affairs and those who have TRICARE who will transition to TRICARE for life. We're going to talk about teachers. We've learned that teachers didn't and usually don't get 100% of their options that are available to them whenever they are approaching Medicare. And that is a huge disservice. And so we've made it a platform to be out there to be sure that we get that information out there. And we're going to talk about people who are working and what you should choose for Medicare, when's the right time for Social Security to hear from you, what's the next step after you apply for original Medicare, all these things. That's what we're going to be talking about in the next quarter. So when I say changes to come, it's going to be the change in the topic. So let's talk about changes. And on January 1st, 2021, a few things took place. First of all, the Medicare Part B premium went up just a little bit, not by much. It is now $148.50. That's a $3 increase, $3.90 increase from 2020. We didn't see a big jump, and that is good. It's the first time in a long time we saw an increase that wasn't very large. And the reason is because Medicare had saved a lot of money over the last 4 years. I did a little bit more research on cms.gov/newsroom, and I found where uh, Medicare had saved over $15 billion that was billed to them through misbilling. I mean, come on, guys. If you're at the register at your local grocery store and they ring you up for 68 cents for green onions, and they're two for $1, you're going to say, "Hey, this is two for $1." That 18 cents, my husband would say, "It's 18 cents, Sandra, let it go." No, I know. No, 18 cents plus the last 18 cents from my last visit, the last 18 cents from the other visit. No, I want it fixed. It's two for $1. Well, finally, somebody had done an audit with Medicare, and Medicare pays 80% of approved services. Well, there was $15 billion that was mispaid, inappropriately billed. So yeah, it does matter going back and checking those bills and seeing what's going on. So by doing that, you guys didn't have, or if you're new to Medicare, the premium is not outrageous compared to what it was projected to be. Because if you remember some of the videos we did last year, the projections of the 2021 premium was going to be fairly high, and we're surprised. And that's why. That's a big impact of why. Not only why, but that's a big reason why. Another change. So the Part B premium was $148.50. Now remember, that is a per month premium. That's a per month. When you first get Medicare, that's the premium. And then you have your Part B deductible, which means what you're going to pay first before Medicare starts paying its 80% responsibility. And remember, you do have a 20% stake when it comes to receiving approved services. That is why we always encourage you guys to talk with someone when it comes to your Medicare. Get help. Make sure that you're getting the right information so you have a backup plan for that 20%, whether it be a Medicare supplement or Medicare Advantage. And if you don't know the difference between the two, that's okay. It's great because that's where we come in. Okay. We are the experts. We will help you figure that out, and we'll help you know which one is right for you. And I'm going to give you our number so you can dial. Um, it's 1-888. I'm putting it here in the chat bar, 689-9701. You call that number, and that is going to be the hotline number to speak with an expert. Let me type that in. Hotline to an expert. There we go. We also have a great customer service department who will help you with the application process if you're new to Medicare. But let's talk about the deductible. So the Part B deductible, I keep stuttering. The Part B deductible is $203 for 2021. And all that is saying is that your first couple of trips to the doctor or hospital or wherever, that not hospital, the doctor, your Part B services for anything Part B. And if you are in the hospital, yes, you will have the deductible if you had not gone to the doctor first for the year. Your first responsibility is $203. After that, Medicare pays 80% of approved services, and then you're responsible for the other 20. And this is why we always want to say, again, you want to get that secondary plan to buffer that 20%. Now, if you are in certain plans, you may not have a Part B deductible. So if you want to learn more about those plans where you don't have that Part B responsibility of a deductible, again, you want to talk to one of the experts and we'll help you find that. And then the Part A. Part A is premium free if you worked for 10 years, known as 40 quarters. When you turn 65, you're eligible for Medicare, and Part A is premium free, but it's not deductible free. If you go in the hospital or you receive hospice or you go into skilled nursing, hang on, I forgot to turn off all of my electronic leashes. And okay, great, great. Let me turn off my electronic leash. We all have one, right? Hang on. And then sometimes they don't wanna work. Okay, I was getting, text messages while I was on there. These are they not electronic leashes? Do y'all feel the same way I do? I mean, remember I know I can remember my phone number growing up before prefixes. I know all of you guys do too, because even though, we may not have been born in the same decade, I think we've shared a lot of the same, memories, the same I said I like my granddaughter, the same memories. Um, but, even today, do you not wonder, like, how did people survive without the cell phone? Yeah, we did. And now it is a leash. You don't go anywhere without it. You don't do anything without it. So, all right, enough of that. Okay, that Part A deductible. If you go in the hospital, you receive skilled nursing before hospital because there's a transition that takes place from hospital to skilled nursing. You don't have that deductible. But if you go immediately in, or if you have to go on hospice, you do have a deductible responsibility, and that is $1,484. It's up by $79 over last year. That $1,484 is due at admission. All that pays for is your bed. We'll say that again. If you're in the hospital, all that pays for is your bed. And that only pays for bed for 60 days. After that, your stay is over. Not really. You stay, you're going to pay. So at day 61 to day 90, you're going to have a daily copay. Okay, so you paid $1,484. Now you're in the hospital, you're in your bed, they're coming in and they're treating you. That's Part B. They're coming in and doing lab work, Part B. They're coming in and reading your chart, Part B. They come in to do a little procedure, Part B. Part A just gets you the bed. You're in there for 60 days. Now and that's up to you. You're either going to be transferred to skilled nursing or you're going to stay. You stay, you pay. You're going to have a daily copay. From day 61 to day 90, if you're still there, you're going to have a higher daily copay. And then at day 150 on original Medicare, you're 100% responsible for that daily copay stay. I would definitely, definitely talk to someone about not having only original Medicare. What is original Medicare? And we're going to go into this in the next quarter more deep, but let's talk real quickly. Medicare Part A and Part B is original Medicare. A is hospital, skilled nursing, hospice, and some home health. Medicare Part B is everything under the sun when it comes to the doctor, the physician, procedures, outpatient, lab work, oxygen tanks, durable medical equipment is what I meant. Transfusions, infusions, vaccinations, all that follows under B. A is for stay, B is for what they do to you. So that is basically all of the original Medicare parts. So then you're like, well, what's Part C and D and E and J, K, L, F, A, B? Those are plans. Those are all plans. And that is why, again, we always say, don't go about it yourself. Medicare is definitely not a do it yourself project. It's not a DIY. You should speak with an expert so we can help you understand all the rest of the alphabet. But when you do get the Medicare card, you have A and B. And that's what we're talking about. Everything starts with that. That's the foundation, A and B. So $1,484, it gets you in the hospital. You're there good for 60 days. Let's say you get out somewhere in between those 60 days. We're going to focus on the 60 days. You get out and you have to go back in. 2 days later, 3 days later, a week later, as long as within that 60-day period, if you go in under the same billing code reason you went in the first time and were discharged, right? You go in for complications of whatever you went in the first time, you don't have to pay that deductible again. You're okay. You're covered in that same benefit period. But you get out and you go back, whether it be one day, 1 week, whatever, within those 60 days. It doesn't matter if it's 3 months later, 3 days later, 3 hours later. If you go back in the hospital under a different billing code reason, which means another reason they're going to send a bill to Medicare for 80%, you're going to be responsible for that $1,484 again. Yes, that's what I said. And this could happen every time you enter a hospital, or if you go on hospice, or you enter skilled nursing directly, you bypass the hospital. You will pay that deductible each time you are admitted, regardless of how many times before, if your reason for going in is unrelated to your discharge previously. I don't know how else to make it more clear, just trying to say there's no cap on it. So that is why, again, you want to have a Medicare health plan. So you get your A and B, and we can help you with that. If you have an underage spouse, we can help you with that. But we want to be sure that you aren't stuck out there at the mercy of original Medicare. Everything starts with original Medicare, but then you build on it, right? You don't just buy a slab, you put the walls up. You protect your shelter. Okay. Well, your money needs to be sheltered by having the right plan around Medicare. Okay. Now, let's talk about a couple of other changes. The insulin benefit. That's huge, guys. If you are taking insulin and if you're diabetic, you're on insulin, yes, your insulin is $35 a month copay. That's it. I know there's been some confusion about that. We had to go back and reread. Again, I go to cms.gov/newsroom. That's where I get all of my information. Now, not all. We also subscribe to a lot of other newsletters that come in from the industry so we can get you this information. But that's where most of what I can get that comes out here and now. So, insulin is $35 copay. If you are a Medicare beneficiary, that is what you should be paying, not more. Okay. And if you're not in the plan that has that, you need to call and talk to us. We will make sure that we can find a way to get you that plan, because not only does it reduce the cost of the insulin, but it also reduces the cost to the overall needs of a diabetic. So your podiatry visits are lower, your urgent care visits are lower, some of the supplies, and there's even food benefits in certain plans for people who have diabetes. So what they were focused on was getting the whole health of the body of someone with diabetes to get better by reducing cost and providing more. And so it started with getting the insulin down so that we know everybody is able to afford their medications. Now, when I say that, I want you to understand that there are still, I know you're out there, you still need help paying for prescriptions. Good, that's okay. We want to help you. If you call in that number, 1-888-689-9701, our one of our experts will get you over to our customer service department. If you are struggling keeping up with the cost of your medications, talk with us. There are programs. We will help you with that application. We'll get it submitted electronically, which means it moves faster through the system, and it's accurately sent in, which means you don't have to have a redo or a delay or whatever the case is. We get it in right the first time. That way you will only pay a third of that cost. Yes, a third of that cost. And so those programs are there. We want to help you, but we can't help you unless you make that call. Okay, you got to initiate the call. Okay, so, and that also applies for the Part B premium. That applies for Part B premium and deductibles. Okay, and they're not plans. These are programs, not plans. These are programs that you may qualify for that you don't even know you're eligible. Okay, now, so the diabetic healing or treatment has been significantly reduced in cost wise when it comes to the Medicare health plan. So it's the insulin, podiatry, urgent care, lots of things. They just want to get the person healthy and access and at an affordable rate. So make sure that if you're paying more than that, that you call and talk to us so we can help you. End stage renal disease. That one I know a lot about because I have someone who is end stage renal. This person was not end stage renal when he signed into a plan. He was not, but he developed it over the years. But what happened was he got locked in the plan because before, if you had end stage renal disease, you could not move into what they call a Medicare Advantage plan. Your only option under the age of 65 was you had to have you have Medicare A and B, and they expedite it for you. Get it within 4 months of your diabetic of your I'm sorry, 4 months of your, where's the word I'm looking for, dialysis treatments. After the fourth dialysis treatment, you move on to Medicare if you have end stage renal. So if you're under 65, so he developed it after the fact of enrolling in Medicare. But when you're under 65, you only have the option of Plan A. Now, if you developed end-stage renal disease and you were in a plan, you weren't able to move around because that is a discharge question, meaning it's the only question on many applications. That's all it is. One question: do you have end-stage renal? It didn't matter if you had cancer or if you had AIDS or HIV or if you had hepatitis or if you had Ebola. It doesn't matter. But if you had end-stage renal disease, that would be a kick out for many plans. That has been taken away. So if you have end-stage renal disease and you have been locked into a plan all these years, or you're on plan A and you're under the age of 65, you now have room to move about. So call and talk with us because there are a lot of benefits out there you haven't had access to before that you will now. Now, know this: if you're turning 65 and you have end-stage renal disease, when you're turning 65, that is a big window for you. It's like the ceiling comes off the roof. You're going to be able to enroll in any Medicare supplement plan available in your state, regardless of any health issues you've had. So if you're turning 65 and you have end-stage renal disease, the roof is about to open up for you. Contact and talk to one of us so that we can be sure you know exactly what you will be able to have access to. A couple of other quick more changes is that Medicare is now much more into technology than they were before. And that's exciting because, like I've said before, they have always said, well, we're going to go with what's been tried and tested and sitting on the shelf for 10 years. And I always think about pacemakers. Pacemakers have come a long way because you remember on Thanksgiving, that relative would say, oh, no, is that the microwave? Let me step out of the room, right? It was like a thing. But now, pacemakers are nothing, but well, they're still something because they make you live, right? But what I mean by nothing is that over time they've gotten better. But the good news is that as technology continues to make medicine better, therapeutic treatments better, process, surgery, whatever the case is, Medicare is going to be more open to approving that procedure, that therapy, that medicine, whatever the case is, if it has been proven to work without the 10-year study. Because we know that by the time something comes out and is in front of the public, it's already been approved before it hit public news, right? Well, now Medicare is going to be more open to getting us that semi-delayed, but much more newer technology when it comes to ventricular devices, when it comes to treatment, when it comes to certain medicines. So that is really cool. This is a good time to be in Medicare. It's a great time to be in Medicare. Here's one more thing. So if you're still working and you're kind of wiggly woggly, you're toggling the idea, maybe you have an underage spouse, that's okay. We have plans to help the underage spouse or dependents. We have those. We have cancer plans, we have dental plans, we have additional hearing and vision plans, especially for people on TRICARE. A lot of people with TRICARE that transition to TRICARE for life. And again, thank you, thank you, thank you, thank you for your service. But a lot of people on TRICARE, they do get those cancer plans and those vision, hearing, dental plans. It's kind of like a combo. They stack it because while you have those benefits, it just kind of enriches them a little bit more. But what I'm saying is, if you are still working or you're still trying to figure out what you're going to do with Medicare, this is a great time to learn what your options are. And don't worry about the spouse or the child you may have that's a dependent on your policy if you're still working, because there are answers and solutions. And we'll tell you, hold up, let's wait on that one. It's not a good idea right now. Or we're going to say, yeah, this could save you this much money and it will give you this much more. We're going to let you know either way because everything we do is unbiased. Everything we do is just facts. Now, the last thing I was going to talk about in changes, sorry, is cancer treatments. Cancer treatments are now going to be bundled, which is what I mean by that. It's really a good deal. If you know someone who's gone through cancer, 1 in every 2 men and 1 in every 3 women have cancer. So you know somebody or you yourself. Therapy could be 7 treatments of radiation, 2 rounds of chemo, 15 rounds of chemo, 3 times a week. It could be radiation 5 days a week. I mean, it would be in a series. And every time you go in and you show your Medicare card, you're also going to pull out your wallet. What Medicare has done is they now bundled it. So they're going to say, if this is a location, this is your location, because even location bills differently to Medicare. It really does. So now they're going to say, okay, this is a location, this is the cost. These are the amount of treatments, this is the cost. This is the procedure, these are the labs, this is the x-rays or the imaging, this is the cost. They bundle it together. It's a one-time thing, not all these separate 80% to Medicare here, 20% to you, 80% to you, 20% to them, or vice versa. You know what I mean? 80, 80, 80, 80 for every treatment, 20, 20, 20 every treatment. No, it's one bundled cost. That significantly reduced red tape. That significantly reduced the wait for the pay for the physicians. That significantly reduced the cost to Medicare, which keeps those premiums down for you and I, and that is remarkable. All right. So other than the last change is that, yes, they've added a new vaccine to Medicare. It's 100% paid for, and that is your COVID-19 vaccine. If you're going to get that, more doctors' offices are starting to get their hands on them. I know pharmacists and pharmacies, local health clinics have it. So the best thing to do is contact your physician if you wish to have that shot, or your pharmacy. I know that most pharmacies have them, and they're calling people and sending out text messages. I want you to join our Facebook page. Go to Trusted Senior Specialist and join our Facebook page. From there, there's a group. Your Medicare Matters Because You Matter. Great group, great resource, a lot of communication in there, a lot of questions and answers. Join the group. Go to our website, tsslovesyou.com. Again, tsslovesyou.com. Let me put it here. The reason I want you to go to the website is because if you need to talk to somebody after hours, or loves you.com. Took me a minute. If you need to do something on the weekend or after hours, and as you know, we work 8 to 8. If you call in and it's after 8, you're not going to get that live receptionist. But what you're going to get is the opportunity to leave a voicemail. I would rather you get on the website, click the calendar, and so excuse me, select the time you want, and then that way you get that live person talking to you, because when you call into our office from 8 a.m. to 8 p.m., you get a live person. You get a real human to talk to. You don't have to push selections and stuff. But if you're calling after hours, you're not going to get that. So I want you to schedule it. If you need to talk to someone after hours, 8 to 8, or on the weekend, schedule that time. And that's the website. Thank you guys for joining us. And again, the change is coming. We're going to be talking about turning 65 and what to expect, how to enroll, when to enroll, and why or why not to enroll. Again, my name is Sandra Ford with Trusted Senior Specialist, Senior Compliance Officer. I look forward to seeing you guys soon, very soon. And don't forget the other platforms. Trusted Senior Specialist on Facebook, and the group Your Medicare Matters Because You Matter. I enjoyed hanging out with you today. Have a great rest of the week.